There are two common pitfalls or key points, if you will, that I really want to make sure that we drive home. Pitfall number one is just being too vague or not clearly stating who did what and when. So instead of just saying something vague, like a nurse-led initiative was implemented to reduce CAUTI rates, say something more specific, like in March of 2024, we've got the date. Clinical nurses in the unit-based council of the medical ICU, more specific. They implemented a nurse-driven catheter removal protocol. So again, that is much more specific about who was involved, when, and what they specifically did. Pitfall number two is to avoid overloading the exemplar with just too many unnecessary background details. So my tip to address this is to really be specific where it matters, but don't over-explain. Really just stick to what Magnet requires. And here are some common areas where too much detail can actually be distracting. So number one is to avoid too much background information. In your EO exemplars, you don't need to put a history of your hospital or your unit, or even really just general statements about patient safety. Number two is to try to avoid too much over-explaining. So avoid long timelines of past initiatives or excessive planning details or really drawn out explanations of why Magnet matters. Trust me, the appraisers know why Magnet matters. Number three is to avoid too much excessive appreciation or acknowledgments. It is really great to acknowledge teamwork and to acknowledge contributions. But that said, really keep the exemplar focused as much as possible on actions and impact. Number four is to avoid unrelated side details. So if your exemplar is about reducing CAUTI rates, then don't include a sidebar about hand hygiene improvements. What I will say though is unless it's directly relevant to the exemplar. Number five, and the last one, is to really avoid the overuse of vague or what I would call maybe soft language. So saying that nurses were empowered to improve care isn't necessarily bad, but if you rely too much on broad, feel-good language and phrases without any evidence behind it, it could maybe weaken the impact of your story. And my final rule of thumb here is that if the information that you're writing up doesn't directly support the problem, intervention, or measurable outcome, I would recommend to err on the side of cutting it.